Hey, this is Dr. Torrey with RookieDoctor.com. Do you know what you're going to do between now and starting your internship and your residency? Well, here's what I think you should be working on, okay? And you're going to hear a lot of advice, and the things that you're going to stress out about are things like zebras and things that you're going to be asked about that you don't know, but that's actually not what you should be focusing on. Instead, you should be focusing on the things that are the bread and butter, the things that will affect your time management and the things that will affect your quick assessment of a patient. So one of those things is becoming proficient at reading EKGs. So you should be studying and looking at EKG after EKG after EKG. If you happen to be doing a rotation with somebody that reads EKGs, like a cardiologist or a primary care that reads them regularly, ask if you can just look over their shoulder and watch them read as they dictate their reading of that EKG, and just keep watching and watching and watching. Keep learning and maybe ask them to point to the things as they see them. That really helped me a lot. So become proficient at reading EKGs, because you're going to want to be able to look at them quickly, make an assessment, and move on. So don't get hung up on zebras and things that you won't see, things that are grossly abnormal, or things that are just not too common. Okay, so focus on EKGs. The next thing is become very proficient at reading chest X-rays. Look online, look in books, take books out from the library, buy books from Amazon, do something, but read EKGs and chest X-rays, and read a lot of both. Okay, same thing. You can ask a radiologist. You have some downtime on a current rotation or something. Go sit behind a radiologist while they dictate the readings. You can learn a lot when that happens. Okay. The next thing, familiarize yourself with your pocket references. Whichever references you're going to have in your pocket when you're on call, when you're going through your training, make sure you get familiar with them. Mark certain pages, do certain things like that. Don't worry about having too many or the right ones or whatever. Once you choose a pocket reference, and on other parts of the site I mention this, once you choose the pocket reference, become familiar with it. Okay? Next thing, familiarize yourself with normals and commons. Normal exams, normal lab findings, and common findings. When you're doing your training, your upper level residents and things like that, they're going to say things like, "Oh, that's a chest pain. Who cares about chest pain? Blah blah blah." Well, guess what? You have to become good at managing chest pain. You have to become good at admitting someone with that. You have to become good at admitting someone with a TIA or a stroke. These things, they're common. You got to know how to do them. You got to know how to do them fast, efficiently, appropriately, and accurately. Okay? And the next thing is relax. Right now my voice sounds pressured only because my kids could be screaming any minute in the background. I'm getting ready to leave, but I wanted to get this video out to you. Relax. Take a chill. Relax and take a deep breath. You're right where you need to be. You're going to know everything you need to know at the time you need to know it. So take some time. If you have time off, make sure it's time off. Don't go crazy studying this stuff. You should, when you're at work, learn in all of your downtime. But when you're off, take some time to relax, especially between now and starting your internship, because you're not going to have much time in the future, okay, at least in the near future. So there you have it. Now let me tell you, I think you should also go to internship-tips.com, and don't forget the dash, internship-tips.com, to get some more tips for your training. And also there's an opportunity there where you can sign up for a Rookie Doc membership where you get stuff every week. Now you don't have to sign up for that, but there's also other materials there. So go ahead and check it out. I think it's really going to help you, and I'd love to know your feedback. So go to internship-tips.com and let me know what you think.